on December 31, 2019, who was informed of cases of pneumonia of unknown cause in Wuhan City, China. A novel coronavirus was identified as the cause by Chinese authorities on January 7, 2020 and was temporarily named 2019 nCoV. Many health experts believe that the new strain of coronavirus likely originated in bats or pangolins. The first transmission to humans was in Wuhan, China. Although the transmission of coronaviruses from animals to humans is a rare trusted source, this new strain likely came from bats, though one study suggests pangolins may be the origin. However, it remains unclear exactly how the virus first spread to humans. Some reports trace the earliest cases back to a seafood and animal market in Wuhan. It may have been from here that SARS-CoV-2 started to spread to humans.
As of September 20, 2021, statistics shown worldwide coronavirus cases is 2,470,235. The death is 37,405. Lastly, recoveries 2,267,720. The Philippine total cases September 2020-21 is 2,470,231. The new cases is 16,903 and total death is 37,406 and recovered 2,267 and 750. The active cases is 165,000 and 110.
COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. The most common symptoms of COVID-19 according to the World Health Organization are fever, tiredness, and dry cough. A few patients complain of aches and pains, nasal congestion, and runny nose, a sore throat, or diarrhea.
COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. Most common symptoms: fever, dry cough, tiredness. Less common symptoms: aches and pains, sore throat, diarrhea, conjunctivitis, headaches, loss of taste or smell. Serious symptoms: difficulty breathing or shortness, chest pain or pressure, loss of pressure or movement. Additional symptoms are possible will be happen. Symptoms may appear between 2 to 14 days after exposure to the virus. Children have similar but usually milder symptoms than adults. Older adults and who have severe underlying medical conditions like heart or lung disease or diabetes are at the highest risk of more serious complications from COVID-19. That is according to the World Health Organization.
The impact of COVID-19 on people living there, health, and our food system. The COVID-19 pandemic has led to a dramatic loss of human life worldwide and present an unprecedented challenge to our public health, food system, and the world of work. The economic and social disruption caused by the pandemic is devastating. Tens of millions of people are at risk of falling into extreme poverty, while the number of undernourished people currently estimated at nearly 690 million could increase by up to 132 million by the end of the year. The pandemic has been affecting the entry food system and has led where its fragilely board, close tried interaction and confinement measures have been prevented. Measures have been prevented farmers from access market, include for buying input and selling their product, and agriculture worker from having crops. Their description domestic and international food supply claim and reducing access to health, safe and diversity details.